Major trauma. Major trauma is any injury that has the potential to cause prolonged disability or death. There are many causes of major trauma, blunt and penetrating, including falls, motorway collisions, stabbing wounds, and gunshot wounds, depending on the severity of injury, quickness of management and transportation to an appropriate medical facility, called a trauma center, may be necessary to prevent loss of life or limb. The initial assessment is critical and involves a physical evaluation and also may include the use of imaging tools to determine the types of injuries accurately and to formulate a course of treatment. The financial cost of trauma includes both the amount of money spent on treatment and the loss of potential economic gain through absence from work. The average financial cost for the treatment of traumatic injury in the United States is approximately $334,000 per person, making it costlier than the treatment of cancer and cardiovascular disease. One reason for the high cost of the treatment for trauma is the increased possibility of complication, which leads to the need for more intervention, making trauma centers costly because they are often continual and maintain a state of readiness to receive patients even if there are none. In addition to the direct costs of the treatment, there also is a burden on the economy due to the to lost wages and productivity, which in 2009 accounted for approximately 619.5 billion in the United States. Trauma is the sixth leading cause of death worldwide, resulting in 5 million or 10% of all deaths annually. It is the fifth leading cause of significant disability. About half of trauma deaths are in people aged between 15 and 45 years, and trauma is the leading cause of death in this age group. Injury affects more males. 68% of injuries occur in males, and death from trauma is twice as common in males as it is in families. This is believed to be because males are much more willing to engage in risk-taking activities. Teenagers and young adults are more likely to need hospitalization from injuries than other age groups. while elderly persons are less likely to be injured. They are more likely to die from injuries sustained due to various physiological differences that make it more difficult for the body to compensate for the injuries. The primary causes of trauma death central nervous systems injuries and substantial blood loss. Various classification scales exist for use with trauma to determine the severity of injuries, which are used to determine the resources are used and for statistical collections. Citizens of low and middle income countries often have high mortality rates from injury. These countries accounted for 89% of all deaths from injury worldwide. Many of these countries do not have access to sufficient surgical care, and many do not have a trauma system in place. In addition, most low and middle income countries do not have a pre-hospital care system that treats injured persons initially and transports them to hospital quickly, resulting in mass casualty patients being transported by private vehicles. Also, their hospitals lack the appropriate equipment, organizational researchers, or trained staff. By 2020, the amount of trauma-related deaths is expected to decline in high-income countries, while in low to middle-income countries it is expected to increase. Injuries generally classified by either severity, the location of damage, or a combination of both. Trauma also may be classified by demographic group, such as age or gender. It also may be classified by the type of force applied to the body, such as blunt trauma or penetrating trauma. For research purposes, injury may be classified using the barrel matrix. The purpose of the matrix is for international standardization of the classification of trauma. Major trauma sometimes is classified by body area injuries affecting 40% polytrauma, 30% head injuries, 20% chest trauma, 10% abdominal trauma, and 2% extremity trauma. Various scales exist to provide a quantifiable metric to measure the severity of injuries. The value may be used for training patients or for statistical analysis. Injury scales measure damage to anatomical parts, physiological values, blood pressure, comorbidities, or a combination of those. The abbreviated injury scale and the Glasgow Coma scale are used commonly to quantify injuries for the purpose of triaging and allow a system to monitor or treat a patient's condition in a clinical setting. The data also may be used in epidemiological investigation and for research purposes. Approximately 2% of those who have experienced significant trauma have a spinal cord injury. Causes injuries may be caused by any combination of external forces that act physical against the body. The leading causes of traumatic death, blunt trauma, motor vehicle collisions, and falls, followed by penetrating trauma such as stab wounds or implanted objects. Subsets of blunt trauma are both the number 1 and 2 causes of traumatic death. For statistical purposes, injuries classified as either international, such as suicide, or unintentional, such as motor vehicle collision. Intentional injuries, common cause of traumas. Penetrating trauma is caused when a foreign body, such as bullet or a knife enters the body tissue, creating an open wound. In the United States, most deaths caused by penetrating trauma occur in urban areas, and 18% of these deaths are caused by firearms. Blast injury is a complex cause of trauma because it commonly includes both blunt and penetrating trauma, and also may be accompanied by a burn injury. Trauma also may be associated with a particular activity, such as an occupational or sports injury. The body responds traumatic injury both systematically and at the injury site. This response attempts to protect vital organs such as the liver to allow future cell duplication and to heal the damage. The healing time of an injury depends on various factors, including sex, age, and the severity of injury. The symptoms of injury may manifest in many different ways, including altered mental status, fever, increased heart rate, generalized edema, increased cardiac output, increased rate of metabolism. Various organ systems respond to injury to restore homeostasis by maintaining perfusion to the heart and brain. Inflammation after injury occurs to protect against future damage and start the healing process. Prolonged inflammation may cause multiple organ dysfunction syndrome or systemic inflammatory response syndrome. Immediately after injury, the body increases production of glucose through the gluconeogenesis and its consumption of fat via lipolysis. Next, the body tries to replenish its energy stores of glucose and protein via anabolism. In this state, the body will temporarily increase its maximum expenditure for the purpose of healing injured cells. The initial assessment diagnosis. The initial assessment is critical in determining the extent of injuries and what will be needed to manage an injury and for treating immediately life threats. Primary physical examination is undertaken to identify any life-threatening problems, after which the secondary examination is carried out. This may occur during transportation or upon arrival at the hospital. The secondary examination consists of a systematic assessment of the abdominal, pelvic, and thoracic areas, a complete inspection of the body surface to find all injuries, and a neurological examination. Injuries that may manifest themselves later may be missed during the initial assessment, such as when a patient is brought into a hospital emergency department. Generally, the physical examination is performed in a systematic way that first checks for any immediate life threats, primary survey, and then taking a more in-depth examination, secondary survey. Patients with major trauma commonly have chest and pelvic X-ray taken, and depending on the mechanism of injury and presentation, forced assessment with sonography for trauma, exam to check for the internal bleeding for those with relatively stable blood pressure, heart rate, and sufficient oxygenation. CT scans are useful. Full body CT scans, known as PEM scans, improve the survival rate of those who have suffered major trauma. These scans use intravenous injections for the radiocontracts agent, but not oral administration. There are concerns that intravenous contrast administration in trauma situation without confirming adequate renal function may cause damage to kidneys, but this does not appear to be significant. In the USA, CATA or MRI scans performed on 15% of those with trauma in emergency departments, where blood pressure is low or the heart rate increased, likely from bleeding in the abdomen. Immediate surgical bypassing a CT scan is recommended. Modern 6-in-4 slice CT scans are able to rule out with a high degree of accuracy significant injuries to the neck following blunt trauma. Surgical techniques using a tube or catheter to drain fluid from the peritoneum chest or the pericardium around the head, often used in cases of severe blunt trauma to the chest or abdomen, especially when a person is experiencing early signs of shock in those with low blood pressure, likely because of bleeding in the abdominal cavity, cutting through the abdominal wall. Surgically is indicated by prevention, by identifying risk factors present within a community and creating solutions to decrease the incidence of injury. Trauma referral systems may help to enhance the overall health of a population. Injury prevention strategies are commonly used to prevent injuries in children who are high-risk populations. Injury prevention strategies generally involve education and the general public about specific risk factors and developing strategies to avoid or reduce injuries. Legislation intended to prevent injury typically involves seat belts, child car seats, helmets, alcohol control, and increased enforcement of the legislation. Or other controllable factors such as the use of drugs, including alcohol or cocaine, increase the risk of trauma by increasing the likelihood of traffic collision, violence, and abuse occurring. Prescription drugs such as benzodiazepine may increase the risk of trauma in elderly people. The care of actually injured people in a public health system requires the involvement of bystanders, community members, health care professionals, and health care systems. It encompasses pre-hospital trauma assessment and care by emergency medical service personnel, emergency department assessment, treatment, stabilization, and in-hospital care among all age groups. An established trauma system network is also an important component of community disaster preparedness, facilitating the care of people who have been involved in disasters that cause large numbers of casualties, such as earthquakes. Most research on trauma occurs during war and military conflicts, as militaries will increase trauma research spending in order to prevent combat-related deaths. Some research is being conducted on patients who were admitted into an intensive care unit of trauma center and received a trauma diagnosis that caused a negative change in their health-related quality of life, with a potential to create anxiety and symptoms of depression. New nerve-preserved blood products also being researched for use in pre-hospital care. It is impractical to use the currently available blood products in a timely fashion in remote rural setting or in trades of war. Thank you for listening. Goodbye.